Welcome to Daily Life First YouTube channel. Today you will learn how personality is defined. You will also learn about the various types of personality disorders patients can suffer from. There is a wide variety and all are characterized in different ways. We will discuss some causes, symptoms, treatment, and clusters of personality disorders. Please ensure that medication can only be prescribed by a psychiatrist or a licensed medical professional. Topics to be covered: antisocial personality disorder, borderline personality disorder, histrionic personality disorder, narcissistic personality disorder, dependent personality disorder, avoidant personality disorder, obsessive compulsive personality disorder, paranoid personality disorder, schizoid personality disorder, and schizotypal personality disorder. What is personality? Personality is a set of enduring patterns of thought, feeling, and behavior that make each person unique. Various factors can shape personality, including genetics, environment, and life experience. What is personality disorder? A personality disorder is a mental health condition that involves long-lasting, inflexible patterns of thinking, feeling, and behaving that can cause significant distress or impairment in one's life. There are 10 types of personality disorders, each with its unique set of symptoms. Symptoms of personality disorder can vary depending on the type of disorder, but they may include distorted thinking. People with personality disorder may have difficulty understanding or relating to others and have unrealistic expectations of themselves or others. Abnormal behavior. People with personality disorders may engage in impulsive or risky behavior or have difficulty controlling their emotions. Distress. People with personality disorders may experience significant pain or impairment in their work, school, or personal relationships. Causes of personality disorders. The exact causes of personality disorders is unknown, but it is thought to be caused by a combination of genetic and environmental factors. Genetic factors. Studies have shown that people with personality disorders are more likely to have a family history of the condition. This suggests that there may be a genetic component to personality disorders. Environmental factors. People who experience abuse, neglect, or trauma in childhood are more likely to develop personality disorders. This suggests that environmental factors can also play a role in the development of the condition. Here are some additional information about the causes of personality disorders. Brain structure. People with personality disorders may have differences in the form of the brains, particularly in the areas that control emotion and impulse control. Neurotransmitters. People with personality disorders may have imbalances in certain neurotransmitters, such as serotonin and dopamine. These neurotransmitters play a role in mood, behavior, and decision making. Hormones. People with personality disorders may have higher testosterone levels, a hormone linked to aggression. It is important to know that these are just some possible causes of personality disorders. The exact causes of the condition is still unknown. Symptoms of personality disorders. Personality disorders are a group of mental health conditions that are characterized by inflexible and maladaptive patterns of behavior. Thinking, feeling, behaving. These patterns can cause significant distress or impairments in a person's life. Types of personality disorder. Personality disorders are divided into clusters, and we are going to explain based on the clusters. 1. Cluster A. 2. Cluster B. 3. Cluster C. Cluster A consists of paranoid personality disorder, schizoid personality disorder, schizotypal personality disorder. Cluster B consists of antisocial personality disorder, borderline personality disorder, histrionic personality disorder, narcissistic personality disorder. Cluster C consists of dependent personality disorder, avoidant personality disorder, obsessive compulsive personality disorder. Cluster A personality disorders are characterized by odd, eccentric thinking or behavior. They include paranoid personality disorder, schizoid personality disorder, and schizotypal personality disorder. What is paranoid personality disorder? Paranoid personality disorder is a mental health condition in which people distrust others. They may believe others are trying to harm, exploit, or deceive them. This distrust and suspicion can interfere with their work, relationships, and overall quality of life. People with PPD often view the world negatively and see others as untrustworthy and dangerous. They may be hyper-vigilant and constantly on the lookout for signs of danger. They may also be reluctant to confide in others or share personal information. Here are some of the symptoms of paranoid personality disorder. 1. Pervasive distrust and suspicion of others. People with PPD have pervasive doubt and fear of others. They may believe others are trying to harm, exploit, or deceive them. Interpreting binary remarks as threatening. People with PPD may interpret binary statements as threatening. For example, they may believe that a co-worker's smile signifies hostility. 3. Bearing grudges. People with PPD may hold grudges for long periods. They may be unwilling to forgive others even for minor offenses. 4. Being reluctant to confide in others. People with PPD may be unwilling to confide in others or share personal information. They may fear that others will use this information against them. 5. Being hypervigilant. People with PPD may be hypervigilant and constantly looking for signs of danger. They may be easily startled and may have difficulty relaxing. 6. Having a negative view of the world. People with PPD often have a very negative view of the world. They may see others as being untrustworthy and dangerous. Causes of PPD. The exact cause of PPD is unknown, but it is thought to be caused by a combination of genetic and environmental factors. Some of the causes of PPD include genetics. Studies have shown that people with PPD are more likely to have a family history of the disorder. This suggests that there may be a genetic component to PPD. Brain chemistry. People with PPD may have imbalances in certain brain chemicals such as serotonin and dopamine. These imbalances have contributed to the development of PPD. Brain structure. People with PPD may have differences in brain structure, such as a smaller size in the amygdala, a region of the brain involved in fear and anxiety. Life experiences. Some people may develop PPD after experiencing a traumatic or stressful life event. Personality traits. People with certain personality traits, such as perfectionism and anxiety, may be more likely to develop PPD. It is important to know that not everyone who experiences these factors will develop PPD. Treatment of PPD. Treatment may involve therapy, medication, or a combination of both. Therapy can help people with PPD understand their condition and learn how to cope with their symptoms. Therapy can also help people with PPD develop healthier ways of thinking and behaving. 1. Psychodynamic therapy. This type of therapy focuses on understanding the unconscious mind and how it contributes to PPD symptoms. 2. Cognitive behavioral therapy, CBT. This type of therapy focuses on changing the way people think and behave to reduce symptoms. 3. Dialectical behavior therapy, DBT. This type of therapy is designed to help people regulate their emotions and improve their relationships. Medication can help to reduce anxiety and may improve mood. Drugs may be combined with therapy to help people with PPD manage their symptoms. Several different medications can be help people with PPD Schizoid personality disorder. A schizoid personality disorder is a condition where a person shows very little, if any, interest, ability to form relationship with other people. It is tough for a person to express a full range of emotions. If you have a schizoid personality disorder, you may be seen as keeping to yourself or rejecting others. You may not be interested in or able to form close relationships or romantic relationships. Because you do not show emotions, it may appear that you do not care about others or what's happening around you. Symptoms of schizoid personality disorder: lack of interest in social or personal relationships, preferring to be alone, limited range of emotional expression, inability to take pleasure in most activities, failure to pick up typical social cues, the appearance of being cold or indifferent to others, little or no interest in having sex with another person. Causes of schizoid personality disorder. Personality is the blend of thoughts, emotions, and behaviors that makes you unique. It is how you view, understand, and relate to the outside world. It is also how you see yourself. Personality forms when you are a child. It is shaped through a blend of your surroundings and genes from your parents. Children typically learn over time to properly understand social cues and take action. What causes schizoid personality disorder to happen is not known, but a blend of your surroundings and genes passed down to you may play a role in developing the condition. Treatment of schizoid personality disorder. 1. Talk therapy. If you would like to build closer relationships, forms of cognitive behavioral therapy may help you change the beliefs and behaviors that can cause problems in your relationships. A therapist knows that you need support to explore your relationships and how hard it can be to open up about your inner life. Therapists listen to you and help you work toward goals that you identify for yourself. Group therapy. In any group setting, you can learn how to talk with others who are also learning and practicing new social skills. In time, group therapy may provide the support needed to improve social skills. Medicines. There is no specific drug to treat schizoid personality disorder, but certain medication can help with issues such as anxiety or depression. You can make significant progress and improve your quality of life with proper treatment and a skilled therapist. Schizotypal personality disorder. Schizotypal personality disorder, STPD, is a mental health condition marked by a consistent, intense discomfort with close relationships and social interactions. People with STPD have distorted views of reality, superstitions, and unusual behaviors. Their relationships are usually hindered by their symptoms. Symptoms of schizotypal personality disorder: peculiar dress, thinking beliefs, speech or behavior. Odd perceptual experiences, such as hearing a voice whisper your name, flat emotions, or inappropriate emotional responses. Social anxiety and the lack of discomfort with close relations. Indifference, inappropriate or suspicious reactions to others. Magical thinking, believing you can influence people and events with your thoughts. They believe that specific casual events or events have hidden messages meant only for you. Treatment for schizotypal personality disorder includes group therapy. This is a type of psychotherapy in which a group of people meet to describe and discuss their problems together under the supervision of a therapist or a psychologist. Group therapy may help someone with schizotypal personality disorder develop social skills because it addresses social anxiety and awkwardness. However, people with more severe symptoms may be disrupted in group therapy, especially if they have prominent paranoid thinking and behaviors. Cognitive behavioral therapy. This is a structured, goal-oriented therapy. A therapist or psychologist helps someone take a closer look at their thoughts and emotions to understand how their thoughts affect their actions. For someone with schizotypal personality disorder, a therapist may focus on reality testing and attention to interpersonal boundaries. They may also help the person recognize distorted thinking patterns such as referential, paranoid, or magical thinking. B. These personality disorders involve dramatic and emotional thoughts and behaviors that can keep changing. These include antisocial personality disorder. Antisocial personality disorder is a mental health condition in which people consistently disregard the rights of others and the rules of society. People with ASPD may lie, cheat, steal, or act impulsively without considering the consequences of their actions. They may also be aggressive or violent and have difficulty forming and maintaining relationships. ASPD is a severe condition that can significantly impact a person's life. People with ASPD may struggle to hold jobs, maintain relationships, and follow the law. They may also be at risk of developing other mental health conditions such as substance abuse disorders and mood disorders. Causes of antisocial personality disorder, ASPD. The exact cause of antisocial personality disorder is unknown, but it is thought to be caused by a combination of genetic and environmental factors. Genetic factors. Studies have shown that people with ASPD are more likely to have a family history of the disorder. This suggests that there may be a genetic component of ASPD. Environmental factors. People who experience abuse, neglect, or trauma in childhood are more likely to develop ASPD. This suggests that environmental factors can play a role in the development of the disorder. Here are some other additional information about the causes of ASPD. Brain structure. People with ASPD may have differences in the structure of their brains, particularly in the areas that control emotion and impulse control. Neurotransmitters. People with ASPD may have imbalances in certain neurotransmitters, such as serotonin and dopamine. These neurotransmitters play a role in mood, behavior, and decision makings. Hormones. People with ASPD may have higher testosterone levels, a hormone linked to aggression. Here are some of the signs and symptoms of ASPD. Disregard the rights of others. People with ASPD may lie, cheat, steal, or act impulsively without considering the consequences of their actions. Failure to conform to social norms. People with ASPD may violate the law, engage in risky behavior, or have disregard for the rights of others. Impulsivity. People with ASPD may act without thinking about the consequences of their actions. They may also have difficulty controlling their emotions. Aggressiveness. People with ASPD may be aggressive or violent. They may also be physically or verbally abused. Lack of remorse. People with ASPD may not feel remorse for their actions. They may also be indifferent to the pain or suffering they cause others. Early onset of conduct disorder. People with ASPD often have a history of conduct disorder, which is a pattern of behavior that includes aggression, theft, and vandalism. 7. Impairment in work or school functioning. People with ASPD may need help holding jobs or maintaining relationships. They may also need help following the rules of schools or work. Treatment of antisocial personality disorder. Treatment that can help to manage the symptoms. Treatment may involve therapy, medication, or combination of both. Therapy can help people with ASPD to understand their behavior and learn how to manage their emotions. Therapy can also help people with ASPD to develop better interpersonal skills and build healthy relationships. Borderline personality disorder. Borderline personality disorder, BPD, is a mental health condition characterized by unstable relationships, intense emotions, impulsive behavior, and a distorted self-image. People with BPD often feel on a roller coaster of emotions and may have difficulty controlling their behavior. They may also have a fear of abandonment and may have trouble trusting others. BPD is a severe mental health condition, but it is treatable with the proper treatment. People with BPD can learn to manage their symptoms and live healthy and fulfilling lives. Cause of borderline personality disorder, BPD. The exact cause of borderline personality disorder, BPD, is unknown, but is thought to be caused by a combination of genetic and environmental factors. Genetic factors. Studies have shown that people with BPD are more likely to have a family history of the disorder. This suggests that there may be a genetic component to BPD. Environmental factors. People who experience abuse, neglect, or trauma in childhood are more likely to develop BPD. This suggests that environmental factors can also play a role in the development of the disorder. Symptoms of borderline personality disorder. Intense emotions. People with BPD often experience intense emotions. They may feel anger, sadness, anxiety, or joy very intensely. They may also have difficulty regulating their emotions, leading to impulsive behavior. Distorted self-image. People with BPD often have a distorted self-image. They may have a very negative view of themselves, or they may have an inflated sense of self-importance. Treatments of personality disorder. There are treatments that can help to manage the symptoms. Treatment for BPD typically involves a combination of therapy and medication. Histrionic personality disorder. Histrionic personality disorder is a mental health condition characterized by a pervasive pattern of excessive attention-seeking behaviors. People with HPD may be overly dramatic, emotional, and seductive. They may also need to be the center of attention and may be uncomfortable when they are not the focus. Here are some of the symptoms of HPD. Excessive need for attention. People with HPD may constantly seek attention from others. They may do this by being overly dramatic, emotional, or seductive. 2. Shallow emotions. People with HPD may have difficulty expressing deep feelings. They may also tend to change their emotions quickly. Superficial relationships. People with HPD may have difficulty forming deep, meaningful relationships. They may also be more likely to have relationships based on physical attraction or superficial qualities. 4. Self-centeredness. People with HPD may be self-centered and may have difficulty considering the needs of others. Dramatic behavior. People with HPD may engage in surprising or attention-seeking behaviors. This may include strong emotions, exaggerating their experiences, or making claims of unique talent or abilities. Sensitivity to criticism. People with HPD may be susceptible and overreact to minor feedback. Unrealistic expectations. People with HPD may have unrealistic expectations of themselves and others. They may also view themselves as more important or unique than they are. Causes of histrionic personality disorder. Here are some of the possible causes of HPD. 1. Genetics. Studies have shown that people with HPD are more likely to have a family history of the disorder. Childhood trauma. Children who experience abuse, neglect, or abandonment are more likely to develop HPD. Attachment problems. People with HPD often have insecure attachment styles. This means that They may have difficulty trusting others and may have a fear of abandonment. Neurobiological factors. People with HPD may have different brain structures and functions. These differences may contribute to the development of the disorder. Personality factor. People with HPD may have certain personality traits that make them more vulnerable to developing the disorder. These traits may include impulsivity, emotional dysregulation, and difficulty regulating emotions. Treatment of HPD. Treatment of histrionic personality disorder. HPD. There are treatments that can help to manage the symptoms. Treatments involve therapy, medication, or a combination of both. Therapy, it can help people with HPD to understand their condition and learn how to cope with their symptoms. Therapy can also help people with HPD to develop healthier relationships and improve their self-esteem. Medication, it can help to reduce anxiety and improve mood. Medication may be combined with therapy to help people with HPD manage their symptoms. Cluster C. This personality disorder involve anxious and fearful thoughts and behaviors. It includes avoidant personality disorder. Avoidant personality disorder is a mental health condition in which people fear social situations and interactions. They may also worry about being criticized or rejected and avoid social problems altogether. People with avoidant personality disorder often have low self-esteem and feel inadequate. They may also have difficulty forming and maintaining relationships. Symptoms of avoidant personality disorder include avoiding social situations. People with AVPD may avoid social problems altogether or only participate in social situations if they feel very comfortable with the people involved. Worrying about being criticized or rejected. People with AVPD may worry about being blamed or rejected by others, even if there is no evidence to suggest this will happen. Feeling inadequate. People with AVPD may have low self-esteem and feel bad. They may compare themselves to others and feel they don't measure up. 4. Difficulty forming and maintaining relationships. People with AVPD may have trouble developing and maintaining relationships. They may hesitate to get close to others for fear of being hurt or rejected. Avoidant personality disorder causes and risk factors. Avoidant personality disorders does not have one definite cause. Several experiences and risk factors can make you more likely to develop an avoidant personality disorder, including having other mental health conditions like depression, anxiety, a family history of depression, anxiety, or personality disorders, childhood abuse, trauma, or neglect. Trauma includes suffering an extreme incident of ridicule or rejection in childhood, genetic trauma, or a physical illness that alters your appearance beyond societal norms. Treatments may involve therapy. Therapy can help people with AVPD understand their condition and cope with their fears. Therapy can also help people with AVPD to develop social skills and build confidence. Medication or a combination of both can help reduce anxiety and improve mood. Medication may be combined with therapy to help people with AVPD manage their symptoms. Dependent personality disorder is a mental health condition in which people have a pervasive need to be cared for by others. People with DPD may feel helpless, submissive, and incapable of caring for themselves. They may have trouble making simple decisions, but with help, someone with a dependent personality disorder can learn self-confidence and self-reliance. Here are symptoms of DPD. Feeling helpless and unable to function without help from others. Having a solid need to be taken care of by others. Having to make decisions without the approval or advice of others. Being overly concerned with being abandoned or rejected. Having difficulty expressing disagreements or anger for fear of losing the support of others. Allowing others to make crucial decisions for you even when they are not in your best interest. Feeling uncomfortable or anxious when you are alone. Having difficulty caring for yourself, such as cooking, cleaning, or shopping. Treatment of dependent personality disorder, DPD. Some treatments can help to manage the symptoms. Treatment may involve therapy, medication, or a combination of both. Therapy can help people with DPD understand their condition and learn how to cope with their fears. Therapy can also help people with DPD to develop self-confidence and self-reliance. Medication can help to reduce anxiety and improve mood. Medication may be combined with therapy to help people with DPD manage their symptoms.
Obsessive personality disorder is a personality disorder in which people have a pervasive need for order, perfectionism, and control. They may be overly concerned with details, rules, and schedules. People with OCPD may have difficulty delegating tasks or making decisions. They may also have difficulty expressing emotions or relaxing. Here are some of the symptoms of OCPD. Perfectionism. People with OCPD have a need for perfection that can be debilitating. They may spend hours or even days working on a task, trying to get it just right. Need for order. People with OCPD have a need for order and organization. They may have a very specific way of doing things, and they may become upset if things are not done their way. People with OCPD have a need for control. They may try to control their environment, their work, and even the people around them. Rigidity. People with OCPD are often rigid in their thinking and behavior. They may have difficulty adapting to change, and they may become upset when things are not done the way they used to. Difficult delegating. People with OCPD often have difficulty delegating tasks. They may feel that they are the only ones who can do things right, and they may become resentful when others try to help. Difficulty making decisions. People with OCPD often have difficulty making decisions. They may weigh the pros and cons of every possible option, and they may become paralyzed by indecision. Difficulty expressing emotions. People with OCPD often have difficulty expressing emotions. They may feel uncomfortable expressing their feelings, and they may bottle up their emotions until they explode. Difficulty relaxing. People with OCPD often have difficulty relaxing. They may feel like they always have to be doing something, and they may find it difficult to simply enjoy life. OCPD is a relatively rare disorder affecting about 2% of the population. It is more common in men than in women. The exact cause of OCPD is unknown, but it is thought to be caused by a combination of genetic and environmental factors. Causes of OCD. Some of the possible causes of OCD include genetics. Study has shown that people with OCD are more likely to have a family history of the disorder. This suggests that there may be a genetic component to OCD. Brain chemistry. People with OCD may have imbalances in certain brain chemicals, such as serotonin and dopamine. These imbalances may contribute to the development of OCD. Brain structure. People with OCD may have differences in brain structure, such as smaller size in the orbitofrontal cortex, a region of the brain involved in decision-making and impulse control. Life experiences. Some people may develop OCD after experiencing a traumatic or stressful life event.
Here are some tips to help manage personality disorders we just discussed. 1. Seek professional help. If you think you may have one of these personality disorders, it is important to seek professional help. A mental health professional can help diagnose the disorder and recommend the best course of treatment. 2. Get support. There are many support groups available for people with personality disorders. This group can provide support and understanding from people who are going through the same thing. 3. Learn about personality disorders. There are many resources available to help you learn more about these disorders and have a good knowledge about different types of personality disorders. This can help you understand your condition and how to manage it. 4. Practice self-care. It is important to practice self-care when you have personality disorders. This includes taking care of your physical and mental health. 5. Build healthy relationships. It is important to build healthy relationships. When you have NPD, this can help you feel supported and loved. Conclusion. If you think you or someone you know may have any of these personality disorders, it is important to seek professional help. A mental health professional can diagnose the disorder and recommend the best course of treatment.